Hello everyone, welcome back to Mr. Language. I'm your host Mr. Language, and today I have my friend Anna with me. Hi Anna.
Hi everyone. Hi Mr. Language. I'm so happy to be here. Today our topic is hospital. We will talk about the hospital, different people who work there, common places in a hospital, and useful English phrases for patients and visitors.
Hospitals are important places where many people work to help sick and injured people. It is very useful to know hospital words and how to talk about health in English.
Exactly. Let's start with some simple questions you can ask if you are at a hospital.
For example, you can ask, "Where is the emergency department?" Or, "How can I see a doctor?"
Or, I need a doctor. Can you help me? These are simple and important. Let's give an example.
Sure. Anna, imagine you are at the hospital entrance. A receptionist asks you, "How can I help you?"
I say, I need to see a doctor. I have a high fever and a bad cough.
Very good. The receptionist might say, "Please fill this form and wait in the waiting area." Or, "We will call the nurse."
Now, listeners, try to practice these questions. Repeat, where is the emergency department? I need a doctor. How long is the wait?
Now let's talk about common hospital jobs. There are doctors, nurses, receptionists, pharmacists, surgeons, radiologists, lab technicians, and paramedics.
A doctor diagnoses illness. They examine patients, order tests, and prescribe medicine.
A nurse cares for patients. Nurses check vital signs, give injections, and help patients with daily needs.
A receptionist greets patients at the front desk. They register your name and direct you to the right department.
A pharmacist works in the hospital or a pharmacy. They prepare medicines and explain how to take them.
A surgeon performs operations in the operating room. Surgeons fix injuries or treat serious diseases with surgery.
A radiologist looks at images like X-rays or CT scans to help find what is wrong.
A lab technician tests blood and other samples in the laboratory. Their work helps doctors make a diagnosis.
A paramedic works in an ambulance and brings patients to the hospital quickly. They give emergency care on the way.
Now let's talk about places in a hospital. There is the emergency department, outpatient clinic, ward, pharmacy, laboratory, radiology department, operating room, and reception.
The emergency department is for serious problems that need fast care. If someone has a broken bone or heavy bleeding, they go to emergency.
The outpatient clinic is for appointments. If you have a checkup or a minor illness, you visit the clinic and go home the same day.
A ward is where patients stay after admission. Wards can be for children, surgery, or internal medicine.
The pharmacy is where you pick up medicines. The laboratory is where tests are done. Radiology is where X-rays, ultrasound, and CT scans happen.
The operating room is where surgeons work. It is a sterile area with special equipment.
Now let's practice how to describe symptoms. It is important to tell the doctor exactly how you feel.
You can say, "I have a headache. I have a fever. I feel tired. I have pain in my chest. My stomach hurts. I have trouble breathing."
You can also say, the pain is sharp or dull. It started 2 days ago. It gets worse when I move. It is better after I rest.
If you talk about allergies, say, "I am allergic to penicillin." Or, "I am allergic to nuts."
And if you have medicines, show them. I take medicine for high blood pressure. I take insulin for diabetes.
Now let's talk about polite phrases for visitors. If you visit a friend, you can say, "Where is Ward 3? I'm here to see patient Anna Smith." Or, "What are visiting hours?"
You can ask, can I bring flowers? Is it okay to bring food? Some wards have rules, so it is good to check.
Now let's practice some questions doctors or nurses may ask. They will ask, "What are your symptoms? When did they start? Do you have any allergies? Are you taking any medicine? Do you have a family history of this illness?"
You can answer, my symptoms started yesterday. I have no allergies. I take no regular medicine. My mother had diabetes.
If the doctor asks about pain, you can use a scale. On a scale of 1 to 10, how bad is the pain? Say, "It is a 6 out of 10.
Now let's give examples of short dialogues in the hospital. Repeat after us.
Receptionist: "Good morning, how can I help you?" Patient: "Good morning, I need to see a doctor. I feel very weak."
Nurse: please take a seat. We will call you soon. Patient: thank you.
Doctor: "Where does it hurt?" Patient: My throat hurts, and I have a fever.
Pharmacist. Take 1 tablet twice a day after food. Patient. How long should I take it? Pharmacist. For 5 days.
Ambulance worker. Is the patient breathing? Paramedic. Yes, but he is unconscious. We need to go to emergency now.
Surgeon. The operation will last about 2 hours. Do you have any questions? Patient. Will I feel pain after surgery? Surgeon. We will give you pain relief.
Now let's practice some sentences together. Repeat after us. I need to see a doctor. I have a high fever.
I am allergic to penicillin. I take medicine every morning.
Where is the pharmacy? I need to collect my prescription.
The nurse checked my temperature and blood pressure. I will rest in the ward.
I have pain in my chest. It started 1 hour ago.
Visiting hours are from 10 a.m. to 6 p.m. Please check with reception.
Great. Now listeners, try to make your own hospital sentences. Say, I have, or I need, or where is. Practice with a friend, or record yourself.
Talking about hospitals and health is very useful. You can explain your symptoms, ask for help, and understand instructions from doctors and nurses.
Remember to be clear and honest when you speak to medical staff. Give important details like when symptoms started, if you are on medicine, and any allergies.
Thank you for learning with us today. Practice these phrases every day so you will feel confident if you ever need medical help.
Exactly. Stay healthy and don't be afraid to speak English at the hospital. Thank you for listening to Mr. Language. We hope this episode helps you feel ready to talk about health and hospitals in English.
Yes, keep practicing and take care of yourself. See you next time.
Bye everyone. Stay well and keep learning.